Hey guys, Amber here again. I'm going to be going over what is Alpha 1 here shortly. But first, wanted to give you an update. I've had this ready for almost a week now. But as most of you know, we went to Omaha over the weekend. Dustin had an appointment yesterday and they did an ultrasound, which we haven't heard yet, and switched some of his meds just to help him sleep a little better since he's not sleeping at night, and just some other side effects that he's having from his liver failure. So otherwise, everything else was going good. Got home late last night, about 10:30. Drove through a snowstorm after New Underwood. So it was interesting, but a much needed weekend away. We went to the zoo and ate out a few and went swimming. The boys and I did. So it was a good, much needed little mini vacation type thing. But going back, vlog number 3 now. So what is Alpha 1 antitrypsin deficiency? Well, what it is what Dustin has, for one. But going to explain a little bit about what is Alpha 1, side effects, how you get diagnosed, how you treat, and what to do after that diagnosis. So first off, what is Alpha 1 antitrypsin deficiency? So we just call it Alpha 1. Alpha 1 is a hereditary condition that is passed from the parents to their children through your genes. This can result in either severe lung disease in adults or liver disease in infants, children, and adults. People with Alpha 1 have received 2 defective Alpha 1 genes, one from each parent. There are many types of defective Alpha 1 genes. The most common are called S or Z genes, and then the normal ones are called M. So a person who does not have Alpha 1 will have the 2 M genes. So they'll be MM classified. People who have Alpha 1 will be ZZ or SZ. Usually I haven't heard of a whole lot of SZs for the S. I knew of Zs. So like Dustin's a ZZ. I'm an MM. So the health risks for people with SZ Alpha 1 tend to be less than for those with ZZ. So an Alpha 1 carrier is a person who has one normal gene, so an M, and then one defective gene, so a Z. Being a carrier is very common. So both of the boys, Dominic and Colton, are both carriers, both MZs. Carriers can pass their defective genes to their children. So the result of having 2 defective genes is low or absent levels of that Alpha 1 antitrypsin protein in your blood. This protein is mainly produced in the liver. The main function of that protein is to protect the lungs from inflammation caused by infection or inhaled irritants like smoke or work chemicals. The low level of what we call AAT, or the Alpha 1 antiprotein, in the blood occurs because it's abnormal and can't be released from the liver at a normal rate. This leads to a buildup of that abnormal protein in the liver, which can then cause liver disease. Carriers then have a lower blood level of that protein, but not as low as people with Alpha 1. So they just have to monitor that. So signs and symptoms. So going to the lungs first, which we all know Dustin has a liver. But researching Alpha 1 when I met Dustin is sort of how I got into respiratory. So I'm going to go over the lungs too, because I'm a respiratory therapist. You got to go over the Alpha 1 with the lungs. So symptoms related to the lungs is going to pretty much be COPD. Any symptoms like COPD. So you have your shortness of breath, your wheezing, your chronic cough, sputum production, reoccurring chest colds, year-round allergies, and bronchiectasis, which, yeah. So pretty much COPD or emphysema, which we'll get to later on a little bit more about that. But symptoms related to your liver then is you have unexplained liver disease and elevated liver enzymes. Your eyes and your skin will start turning yellow, which is called jaundice. You'll get swelling of the abdomen called ascites, which if anybody's seen Dustin lately, you can definitely tell he has some ascites going on. Vomiting blood or passing blood in the stool, which he hasn't had. Widespread itching all over his body. He's getting that right now. Any weight loss everywhere else but the body. And so if you've seen Dustin again, he's getting all of these, checking all the boxes. And then in babies, how they will usually determine if it's alpha-1 is your infant or your baby won't be gaining weight like they should be. So they'll be really skinny and small. So then they'll usually test for alpha-1. So what is liver disease? As everybody, maybe you don't know, you will know now. The liver is the largest organ in the body. It is also one of the most important organs in the body because it cleans your blood and helps fight infections. It makes important proteins that travel through your body. So it stores vitamins, sugars, fat, and other nutrients that you eat is all stored in the liver. The liver also breaks down the alcohol, drugs, or any other toxic substances that you put in your body because it doesn't want to harm your body. So that's what a normal functioning liver would do, is break that all down. So liver disease refers to any number of diseases or disorders that stop the liver from working as well as it should. So it's liver disease would mean it doesn't store those nutrients like they should, or it doesn't break down those bad toxins like it should. The exact cause of liver disease in alpha-1 patients is unknown, but it is suspected that it's caused by that buildup of that protein. It clogs up the liver and then basically killing your liver. So nearly 85% of that protein gets stuck in the liver. If that liver can't break down that protein, then it clogs and the liver pretty much becomes damaged. Currently, there is no way to get that protein unstuck. It just stays there. So since not everyone with alpha-1 gets liver disease, there has to be something else contributing to the liver disease. But research are studying that, hoping to find new treatments. Currently, we know nothing yet. So newborns and children who have that ZZ, so they have both, like Dustin, the ZZ genes, is about 1 in 20 kids will develop liver disease that can be serious. So like we had talked in the last one, Dustin had a brother who had a baby, had that liver disease as a baby. Other children, they can have those abnormal labs and very few symptoms, but in most cases, those can resolve by the time the child reaches their teens and their adolescence, and then overall be healthy in the end. Adults with alpha-1 can develop liver disease, which becomes more severe in the middle age and the older they get. So like Dustin. Research shows that chronic liver disease might appear in MZ carriers. So we have to monitor the boys when they get older. So only if the liver has been damaged is when chronic liver disease can happen. So if they start drinking, smoking, any of that to damage their liver, it could get liver disease from alpha-1. Things like, other would be and Hep C and Hep B, hepatitis. But so keep in mind that most children and adults with alpha-1 have no symptoms of liver disease at all. I know Dustin's the rare case, but he had a great uncle, I believe, who just within the last 2 years, he's 65, maybe even older, just within the last 2 years got diagnosed with alpha-1 with liver, and they didn't, no signs, nothing throughout his whole life until just a few years ago. And he may have passed, I don't know, don't quote me on that. So now, of course, get the respiratory out of me. What is lung disease? So because alpha-1 is genetic, alpha-1 lung disease is commonly called genetic COPD. Early diagnosis of alpha-1 is important because you want to quit smoking right away. If a person's smoker gets diagnosed with alpha-1, we want them to stop right away. Early treatment is also essential to help slow down the progression of your alpha-1 lung disease. Alpha-1 is often first diagnosed as asthma or smoke-related COPD. COPD can include chronic bronchitis as well. So alpha-1 is the most common genetic risk factor for COPD patients. About 3% of all people diagnosed with COPD may have undetected alpha-1. So current guidelines recommend that everyone with COPD or unexplained bronchiectasis be tested for alpha-1. And I know one of our pulmonologists here in town test all of his COPD patients. If they do the spirometry and it comes back as COPD, he'll usually get blood testing right away to rule out alpha-1. So I'm glad he does that. I won't mention his name, but yay, thank you. So just some facts about alpha-1. So it is believed that over 20 million people in the US are carriers, and they may not know it. It can be treated, but of course not cured, which we know. It is easily diagnosed through either a mouth swab, which we don't do that often, or just a simple little blood poke. It can go undetected for years, which I had mentioned about Dustin's great uncle. And there are about 100,000 people with alpha-1 in the US. And most people don't know it. I know in the 80s when Dustin was diagnosed, or when my in-laws first found out, it was a rare disease. Not so much anymore. So who gets alpha-1? So anyone with COPD, emphysema, chronic bronchitis, people with bronchiectasis, newborns or children and adults with unexplained liver disease, people with a history of liver disease. If you have a relative that was diagnosed with alpha-1, you might want to go get tested because it usually runs in families. And then anyone with, I'm going to try and pronounce this right, paniculitis. It's a skin disease, I guess, which that is new to me. So testing and diagnosing. So alpha-1 is found pretty much by just a doctor doing a physical exam, and then of course you can't diagnose it until you do that blood test. So lung, though, you do the doctor's exam, they'll do a pulmonary function test and then the blood test. Because with the blood test and the pulmonary function test, I'll tell you if you have COPD and then alpha-1 with that. So the physical exam, you can see an enlarged firm liver or spleen. The blood test includes measuring how much of that protein is in the blood and how well the liver is working. So they usually test your bilirubin and your liver numbers, and if they're elevated, they'll go off of that. So in addition, they can also do an ultrasound, which Dustin had this weekend, of the liver to see what it's doing. Ultrasound, it's painless. You do it through the skin. Women get them all the time. It just takes pictures of the liver. So the specific diagnosis of alpha-1 is made through that blood test. It's called a phenotype test. So that's going to show your gene. So we did a pheno test with the boys, and that's how we found out they were carriers. So the test is going to show you're an M, Z, or an S of that protein in the body. So doctors can also test your genes by doing a genotype, which we didn't do. Since it's hereditary, of course, alpha-1 can be passed on to your kids. So it should be considered when making decisions about having children, and you should discuss it with your family. So that's what we did. The benefits of getting tested is to finally decide to stop smoking. If you're tested early enough to choose not to smoke. Avoiding secondhand smoke, which is a big one we don't want our COPD patients to do. And then avoiding harmful exposure at the jobs and in the environment. And then, of course, with the liver, you want to find out early enough so you can avoid excessive alcohol use and stop drinking. So if you're good about doing all of that, it's at least good to get that type to find out so you can talk to your doctor better to maybe do preventative care, prolong your life and improve your health. But some potential harms now with getting tested and knowing is it can upset you. In the end, you may find out, crap, now I have alpha-1. It's can be a little upsetting. It can affect your ability to get life and disability insurance. We've had that issue with Dustin. He can't get life insurance because of it, because of his existing disease. It can create stress in your family. Can't see it, but I got some gray hairs in here. It creates some stress. And then, of course, it can increase your healthcare cost. So all of that, yes. And you see the zit right here? That's stress. Okay, so questions for your doctor, and then so I'm going to go over some questions of what to ask your doctor. And once you get those results, what do you do? Like, okay, yeah, I have alpha-1. What should I do now? Well, first off, you want to talk to your doctor. Ask him. You want to find a doctor that usually you want to do an alpha-1 doctor. Because Dustin's his liver, we go to a gastroenterologist down in Omaha. He's fantastic. We love him. And then if you have COPD, lung disease, alpha-1, you want to go to a pulmonologist. There's a lot of good ones here in town. But if you're from out of town, definitely find a doctor that works for you. So you want to ask your doctor. I always interview. When we had Dominic, when we were trying to find a pediatrician, I went in and interviewed him. I wanted to know he was going to do what we wanted of him. We wanted him to test for the alpha-1. So definitely I would interview. So ask him, have you treated people? Sorry, let me rephrase that. I got a little heartburn going on. Have you treated other people with alpha-1 antitrypsin deficiency? How can I protect my lungs or my liver? What treatments do you recommend? How will we know how I'm doing? Should I get my children tested? Which is a yes, I can tell you that right now. Those are the main questions. The next few are, I have alpha-1, what should I do now? So first off, you're going to want to create an exercise program. That's big for your lung patients. We want them to be able to keep their lungs working good. So we do pulmonary rehab at the hospital, and that conditions the patient and keeps their lungs working good. And we do have a few alpha-1 patients we've had come through. So definitely do an exercise program. Start that right away. You also want to create a nutrition program. That I'm having a hard time with Dustin. He does not want to eat healthy, but neither do I, so that doesn't help. So we're slowly working on that. It's expensive to eat healthy. I don't know if any of you have been to the grocery store lately, but it's expensive. So you want to do your exercise and your nutrition. You want to think about your smoking and your drinking habits. Dustin, luckily, has never been a smoker. He has a few sips of alcohol every now and then. Hasn't lately. But so you really want to watch your smoking and drinking. If you currently smoke or drink and you have alpha-1, you should probably think about quitting. You want to avoid your risks, that secondhand smoke, any work environmental stuff, pet allergens and all of that. You want to avoid those. Then you want to inform your family. Because it's hereditary, they might want to get tested too. So you want to inform everybody in your family. Every year you want to get a flu shot and your pneumonia vaccine. When you're over the age of 50, I think you get your pneumonia vaccine. So you want to keep doing that. And then at the end of this, I will get you guys some resources. There's some great resources out there of I have alpha-1, what do I do now? So they are very helpful, especially with medications and all of that. It can get a little expensive. I know if we didn't have our insurance and help, Dustin's anti-rejection meds are $1,000 a month. So it's definitely helpful. So I'll get you guys some resources. And of course, I'm always a resource. I have everything on file back there. So if I ran through this too quickly, you can always ask me anything. So the next thing is treatment. So of course, we know there's no cure for alpha-1, but there are ways to prevent or reduce those health problems related to alpha-1. So people with alpha-1 should do the following. You want to get your Hep A and B vaccines. You want to have regular exams with a doctor. You want to have your regular medical tests. So blood work. Dustin gets his every month, at the end of the month. And then he had an ultrasound yesterday, and we found out we'll be doing one every 6 months. So regular ultrasounds. If you have lung, they're probably going to do blood work and x-rays instead of ultrasounds. So, and then they can always do a liver TC or CAT scan, which he had a while ago. So routine labs and routine tests. And of course, I'm not going to sound like a broken record here, but stay away from tobacco smoke and heavy air pollution. That's if you have lung. And then avoid drinking alcohol. Look at that. There that is again. And of course, eat a balanced diet. You want to maintain a healthy weight. And then speak to your doctor before you use any herbal vitamins or other therapies. You want to make sure it's safe. So in severe cases, the only treatment is a liver transplant. That's going to the liver there. There is no treatment to prevent the onset of liver disease, which most of you know. We didn't know until wham bam, there we go. Get a phone call and say your liver's failing after a routine test. So with alpha-1 lung patients, so going to the lung, there's a new thing they're doing. It's called augmentation therapy. I don't believe we do it around here. You have to go to Denver, I think. So you can raise the amount of protein that's in the blood that protects your lungs against the inflammation and lung damage. So that's the augmentation therapy. You can have this treatment if you get the alpha-1 COPD. I asked them about the liver. They said no. So it's also called replacement therapy. So pretty much what they do is they give you a new supply of that protein that comes from the blood of healthy donors. And it's a once-a-week treatment. And they replace, that replacement alpha-1 gets put into your body through your IV. So you just IV injection of that healthy alpha-1 protein. So you can have it done at home with the help of a technician who comes in, or you can go to a doctor's office and do it. But it's once a week, and pretty much it's throughout your whole life. So the whole goal is to slow down that damaging of your lungs. It doesn't reverse it or heal the damage that's already done. It just tries and slows it or stops it. So once you start augmentation therapy, once a week for the rest of your life, you have to do it. So depending on how you're doing with it, you can also, or how you're doing, yeah. So I know most of our patients, because it's COPD, we'll still give them bronchodilators, inhalers, and medications to help them breathe a little easier. So it just helps open your airways, keeps you breathing a little easier. So if you're breathing, so going to the lungs now, since liver is just transplant, with your lungs, if your breathing leads to low levels in your oxygen, then you might have to get put on oxygen. So that's just a little heads up there. And like I had said earlier, more than likely, if you're in the Rapid City area and you have alpha-1 COPD, you will get a referral to pulmonary rehab. And it's a fantastic program. I used to teach it. I've since moved to the other side and just doing inpatients, but the 3 therapists who are over there are fantastic at their job. And yeah, we have some great patients over there. It's fun. It's a fun program. I'd take it if I could, but I don't have COPD that I know of. Okay, so then what to expect after the diagnosis? So I'm diagnosed, what to expect now? So there is a wide variation of how sick people will get from alpha-1. Some patients have severe alpha-1, and then others have little to none and goes undetected for years. So the condition is more likely to cause liver disease than it is lung problems. But with that, still only about 10% of children will have a severe liver disease. Most children affected with alpha-1 liver disease do well and reach childhood without any major problems. And then you have my husband, who didn't. So the lung problems in alpha-1, they usually don't occur in childhood. But it is, so if you have a child who comes back with alpha-1, you'd still want to make sure they're avoiding exposure to cigarette smoke or that heavy air pollution, because you want to protect their lungs at a young age. Otherwise, it can progress fairly quickly when they're older. So sometimes children with alpha-1 can have severe asthma, though. It is best to talk to your doctor and figure out how your alpha-1 and your child's might turn out and what can be done to protect you, your liver or your lung. Some big things is you will be more sensitive to smoke and dust. Even the common cold can lead to breathing problems, so you just want to do that. Winter will be hard, and then the hot will even be hard. Yeah, so you have your days. About 30 to 40% of people with alpha-1 will have liver problems at some point in their life. So finding out if you have alpha-1 is the first step towards a healthier life and healthier habits. And you can find out better medical treatments then to help control your disease. It's not a oh, hey, I have Alpha 1. Great. I'm going to die now. You can change your lifestyle. So it's good to know if you have it sooner rather than later so that you can better your health and hopefully prolong your life. So this support, and then of course I don't have them right next to me here. Let me grab them. So there's all sorts of places to go. I have some pamphlets because we have them at work. And then I got, so the first one is just the Alpha 1 Foundation. They are fantastic. That's where I got most of my information from. If I just to check facts and all of that. And that is who I'm an advocate through, is the Alpha 1 Foundation. So they have a lot. And if they aren't able to help you, there's plenty more. But this pamphlet talks about genetic counseling program. It's a guide for patients, caregivers, families. It's a free service, just to go over pretty much individual counseling. You have Alpha 1, and depression could be one thing that happens with it. So a little counseling to go over, so you don't get depressed or any of that. Some other ones would be, I thought I had some. There we go. So the Alpha 1 Foundation, and their phone number, I have it in here if you want it. Otherwise, just check out alpha1.org. It's a non-profit foundation. It has resources, educations, information on testing. It's a pretty good website. There's also AlphaNet. So it's alphanet.org. It assists patients and families with support, education, and strategies to manage their health. So that's a good one. It has it says here, the Big Fat Reference Guide to Alpha 1. They have that there. So then there's the Alpha 1 Research Registry. So that's just alpha1registry.org. And that one gives patients the opportunity to provide information on their condition for the research aspect. So that way they can do more research on Alpha 1. There's clinical trials, questionnaires, and all of that on that website. And then we have the Alpha 1 Foundation Patient Information Line. That's just a phone number. So if you're newly diagnosed and you're seeking basic information, you can call that line and they can give you some information. And then we have the liver disease. So it's the American Association for the Study of Liver Disease. So it's aasld.org. So that's just more for the liver.